Welcome everyone to a quick medical minute, and today we're going to be talking about edibles, particularly the marijuana edibles, or what we believe are marijuana edibles that we've been seeing quite a uptick from in the past. We're seeing particularly in our high school students taking them during the day or at home. But I want to talk about it real quick. Marijuana edibles, first of all, you never know how much THC is in an edible. You just don't, because it's not regulated, right? So it could have a high risk of having a very high potency of THC, which would be a big problem because you can OD on marijuana, which means you're just going to get a lot of bad side effects, which I'll go over in a second. The other problem is that you don't know what else is in there. So could there be something else? I don't know. Nobody's regulating it. Sometimes you're buying it off the street. Who knows what's in it? I mean, we're finding in our pills, we're finding fentanyl, meth, and what people think are ecstasy. So when you see these patients that are believed to have taken an edible of marijuana, make sure you look at their pupils. Make sure you check them out, that there isn't a likelihood of something else causing it, which could have a reversal effect from Narcan or something else, or just managing them in a different route than what you would with an edible. Now, what are the big complications of edibles when they get too much of any amount of THC? They can get drowsiness, they can get confusion, vomiting, anxiety and panic attacks. You can get agitation, psychotic episodes, hallucinations, paranoia, impaired motor ability, respiratory depression, and then obviously you can get heart problems, anything from irregular heartbeats to, if you're having some tachycardia, you can even get an MI from the higher rate that your heart's putting out, not keeping up cardiac output, not keeping up with your coronary arteries, so then you get a heart attack. So what do? Well, most of the cases, if you have obviously respiratory depression, you're going to manage the airway. If you have someone who is very drowsy, confused, not violent or agitated, you're just going to manage them from a standpoint of check their vitals. If they're hypotensive, fluid bolus. If need be, then you can move on to a pressor if absolutely need be, like Levofed. But the real concern is when you start coming across these patients and they're highly agitated, they're tachycardic, they're freaking out. In those cases, the best thing to do sometimes is give them a touch of Versed. It may not be excited delirium, but giving someone who is freaking out like that maybe just 2 of Versed just to take the edge off and get them to stop being paranoid or freaking out, and maybe helps get their heart rate down, may be a benefit for that patient. But otherwise, the real key with edibles is look at the patient, make sure there isn't a syndrome that doesn't make sense mixed with it. We all know what marijuana can cause. Make sure it fits that picture, and if it doesn't fix that picture, treat it. Otherwise, any questions, you can always reach out to me. Stay safe, everyone.